when I think about vitamins, I'd say, okay, do you recommend a general multivitamin? From what I've observed over the last few years, a lot of the hope that we might be able to prevent certain types of diseases through the use of higher doses of naturally occurring substances like vitamins hasn't really borne out much fact or impact, and in fact, in some situations, has shown the opposite, except for possibly vitamin D.
Well, the vitamin D story is a story in itself, but what you're referring to is there's been numerous studies of advanced diseased patients with vascular disease, heart disease, who are in a study for maybe a cholesterol medicine or some other cardiovascular medicine, and then they've kind of thrown in a couple of vitamins, and they've not been able to show any benefit. Well, again, that doesn't necessarily apply to healthy people because there may be a point at which vitamins are not going to make any difference if you have advanced diabetes and vascular disease. The other thing is these studies tend to be short. Nutritional medicine may not be amenable to be demonstrated to have an advantage in a few years. Look at the blood sugar story. We've always thought that keeping blood sugars low as possible would be a benefit, and that it is a benefit. But the estimate now is that you have to keep it controlled for 20 years before you'll see the benefit. So. So some of this is not going to ever be able to be proven one way or another, but that doesn't mean you can't use your judgment, and I think that's what most of us do.